Disclaimer: this podcast is for informational and educational purposes only. It is not medical advice. Always consult with a qualified healthcare professional before starting, changing, or stopping any medical treatment, including the use of peptides. Today we're diving into Octreotide, a synthetic peptide that mimics the natural hormone somatostatin. Octreotide has been studied for decades and is primarily used in medical settings, but its mechanisms and effects make it a fascinating peptide to understand. It works by binding to somatostatin receptors in the body, leading to reduced secretion of several hormones such as growth hormone, insulin, glucagon, and various gut peptides. This suppression effect is why Octreotide has powerful clinical uses. Let's start by talking about where it's most commonly applied. In clinical medicine, Octreotide is often used to treat conditions caused by excess hormone production. One example is acromegaly, where the body produces too much growth hormone, leading to enlarged hands, feet, and facial features. By mimicking somatostatin, Octreotide helps lower growth hormone levels, easing symptoms and preventing long-term complications. Another major use is in certain neuroendocrine tumors, especially carcinoid tumors and VI palmos. These tumors can secrete hormones that cause severe diarrhea, flushing, and electrolyte disturbances. Octreotide works to slow hormone release, bringing relief to patients. One of the reasons Octreotide is so versatile is because of its receptor activity. It binds to somatostatin receptor subtypes, particularly type 2 and type 5, which are distributed across different tissues. When Octreotide binds, it essentially turns down hormone secretion. That makes it useful not only for growth hormone excess, but also for issues like severe diarrhea from chemotherapy or AIDS, and even for bleeding in the gastrointestinal tract caused by varices. In fact, Octreotide is sometimes given in emergency settings for bleeding esophageal varices because it reduces blood flow to the portal vein and lowers pressure. Let's step back and talk about how Octreotide works at a molecular level. It is an 8-amino acid peptide that has been modified to extend its half-life compared to natural somatostatin. Natural somatostatin is very short-lived, just a couple of minutes, whereas Octreotide can last for hours in the body. This stability allows it to be used as a therapeutic agent. The drug is often injected subcutaneously multiple times a day, or given as a long-acting release formulation that lasts for weeks. This difference in half-life is one of the key advances that made Octreotide clinically practical. Now, what about its effects on metabolism? Since Octreotide reduces insulin and glucagon secretion, it can influence blood sugar levels. In some patients, this can cause hyperglycemia or hypoglycemia, depending on the balance. This means anyone on Octreotide requires monitoring for glucose changes. It also slows gastric emptying and intestinal motility, which is why it can help with certain diarrheal conditions, but can also cause gastrointestinal side effects like abdominal cramping, bloating, nausea, or constipation. Gallstones are another possible side effect due to reduced gallbladder motility. Another interesting point is its role in research beyond approved uses. Some studies have explored whether Octreotide has applications in weight management, given its effects on gut hormones like ghrelin, glucagon like peptide 1, and insulin. The evidence is not strong for mainstream use in obesity, but it highlights how Octreotide interacts with complex metabolic pathways. It's also been investigated in conditions like polycystic kidney disease, where reducing certain growth factors might slow cyst development, though this remains experimental. Let's imagine the journey of a patient with acromegaly. Without treatment, they may experience headaches, joint pain, sweating, and noticeable changes in facial structure. Surgery is often the first line of treatment, removing the pituitary tumor that secretes growth hormone. But if surgery isn't enough, octreotide injections can dramatically improve symptoms. By lowering growth hormone and insulin like growth factor 1, it helps normalize hormone levels, protecting the heart, joints, and other organs. This is life-changing for many patients. Octreotide's dosing varies depending on the condition being treated. For acromegaly, injections might start at 50 to 100 micrograms every 8 to 12 hours, then adjusted as needed. For carcinoid syndrome, the dose can range similarly, but often titrated to control diarrhea and flushing. Long-acting release versions are typically given intramuscularly once every 4 weeks, simplifying treatment for patients. One fascinating angle is how octreotide intersects with peptide research more broadly. In the peptide world, we often think about peptides that stimulate growth, healing, or performance. Octreotide is the opposite. It suppresses, quiets, and slows down processes that are overactive. It's a reminder that peptides are not just about building or accelerating, but also about balancing and controlling. That duality is important. Because octreotide is powerful, it comes with precautions. Patients need monitoring for thyroid function, liver enzymes, vitamin B12 levels, and gallbladder health. It's not typically something used outside of strict medical supervision. But from a learning perspective, it's an excellent example of how modifying a natural peptide hormone can lead to a therapeutic tool that saves lives. If we think about the future, somatostatin analogs are expanding. Variants like lanreotide and passeriotide have been developed to target different receptor subtypes, giving more options depending on the disease. Passeriotide, for example, has stronger activity at receptor type 5, making it useful in Cushing's disease. This shows the peptide field keeps evolving, refining, and tailoring molecules to very specific clinical needs. Octreotide also gives us insight into hormone control as a whole. Many of the body's processes are based on feedback loops. Growth hormone stimulates insulin like growth factor 1, which feeds back to regulate growth. Gut hormones regulate appetite, motility, and nutrient absorption. By using octreotide to intervene in these loops, we can see just how interconnected everything is. It also shows why side effects can be broad, because one peptide influences so many pathways. Now, you might be wondering, does octreotide have any role in longevity or anti-aging research? While it's not a mainstream anti-aging peptide, its ability to reduce growth hormone raises interesting debates. Some researchers suggest that lower growth hormone later in life could reduce risks of certain cancers and metabolic issues, while others emphasize the benefits of growth hormone for maintaining muscle and vitality. Octreotide essentially gives us a tool to explore that balance, though its medical use is very different from wellness applications. There's also a pharmacological lesson here. Octreotide shows how a naturally fleeting molecule can be redesigned for therapeutic stability. Somatostatin's half-life of minutes was a barrier. Chemists tweaked its structure, resulting in octreotide, which lasts hours to weeks, depending on the formulation. That's the kind of innovation that drives peptide medicine forward. Another real-world scenario is variceal bleeding, often seen in patients with liver cirrhosis. These patients can suddenly vomit large amounts of blood due to ruptured veins in the esophagus. Octreotide infusion is given in the hospital to reduce blood flow in the portal system, lowering pressure and helping control the bleeding until more definitive treatments like banding can be done. In emergencies like this, octreotide can be life-saving. To summarize, octreotide is a somatostatin analog used for conditions of hormone excess and certain emergencies. It reduces secretion of growth hormone, insulin, glucagon, and gut peptides. Its benefits include control of acromegaly, relief of carcinoid syndrome, and management of bleeding varices. Side effects include gastrointestinal upset, gallstones, and glucose changes. Long-acting formulations make it more convenient for patients. Research continues to expand on somatostatin analogs, offering more targeted therapies. Disclaimer: this podcast is for educational purposes only and does not replace medical advice. Always talk with a qualified healthcare provider before considering peptide treatments. Thanks for listening, keep learning, and stay curious.